Hello everybody. Open your eyes before AIDS closes it. This is Dr. Nikarika. We at Star Health have taken the initiative to raise awareness on a life-threatening disease, AIDS, acquired immunodeficiency syndrome, on the occasion of World AIDS Day, the 1st of December. It is my honor to welcome our esteemed guest, Dr. Ramasubramanian, a senior consultant of infectious diseases, tropical medicine and HIV at leading hospitals in Chennai. He has authored various international research publications and has played a pivotal role in establishing infectious disease as a specialty in India. Thank you for joining us, Doctor. So the theme for World AIDS Day 2023 is Let Communities Lead. Can you please shed some light on it?
See, AIDS is a disease which we have come across only in the last 40 to 50 years. It is relatively new compared to several older diseases, but one thing is very clear, that people who are HIV positive or people who have AIDS need a lot of support socially. They need moral support, they need mental support. Apart from the physical support they get, the healthcare, they need a lot of psychological input from the community. They should be treated well by the community so that they can lead fruitful lives. So I think the theme this year is very apt for a disease like HIV.
Thank you, Doctor. So the next question is, what's the difference between HIV and AIDS? Or is it a synonym? And can you tell us about the various terminologies?
HIV refers to the human immunodeficiency virus, which is the causative agent for AIDS. When a person gets infected by the human immunodeficiency virus, the virus starts multiplying in the body. It infects a certain type of white blood cell known as the CD4 white cell. So the CD4 white cell is very important for fighting infections. And when the virus enters the cell and starts multiplying, it breaks down the cells. So this gradually leads to a decrease in the number of white blood cells, specifically the CD4 cells, leading to a situation where the person becomes susceptible to various infections. So the early part of HIV, the person is well, he has no symptoms whatsoever, and the disease can be diagnosed only if you do the test. But with time, when the CD4 count drops to low levels, the normal CD4 count for an average human being is about 800 to 1000 or even higher. But when this level reaches to 200 or less than 200, which may take several years, usually in the region of about 8 to 10 years, the person starts getting severe infections, what we refer to as opportunistic infections. And when a person who is HIV positive develops certain conditions which are defined as AIDS defining illnesses, which means that the immune system becomes very weak and he develops certain infections which typically characterize advanced immunosuppression. That condition is called as AIDS, which is acquired immunodeficiency syndrome. So AIDS is just a situation in the course of the HIV illness which typically develops 8 to 10 years after a person gets infected.
Thank you, Doctor. The next question is, how is HIV transmitted?
The human immunodeficiency virus is usually transmitted in 3 ways. It can be transmitted through sexual contact, which is usually penetrative vaginal or anal sex. It can be transmitted through the blood. So if people who are intravenous drug users share contaminated needles through which they can get it, or a contaminated blood. If a person is HIV positive, he donates blood. This blood is not screened or screened inadequately and is transfused to another person, he may develop HIV. The third way is through breast milk. So if a woman gives birth to a child and then breastfeeds the baby, even though the child may not get HIV through delivery, it can still develop the disease through the breast milk. So the 3 main mechanisms, I repeat, are through sexual contact, through blood or blood products, and 3, through breast milk. The normal mechanisms of social contact, touching, holding, hugging, kissing, through using soaps which are commonly used, towels, sharing of towels, or normal contact which you would encounter during in a household, the normal social activities pose no risk for transmission of HIV.
Okay, doctor. How does a person who's been diagnosed to have HIV present?
Now, this is the problem because HIV doesn't come like typhoid or tuberculosis, which as soon as you get it and start manifesting the condition, develops you present as fever, weight loss, tiredness, night sweats. HIV in the initial part, when I say initial part, this could last several years. So I may have gotten HIV today and I may not manifest any symptoms for another 7 to 10 years. So it is a condition which is in the early part of the illness diagnosed purely through a blood test. When the immune system drops to, as I told you, the CD4 count drops to less than 300 or 200, when the immune system becomes weak, when the person is not able to fight diseases, then the manifestations of HIV depends on what infection infects the person who's HIV positive. So the person may present with recurring attacks of diarrhea, the person may present with night sweats, weight loss, tiredness. The person can get several infections. It could be something as simple as shingles or herpes zoster. It could be some fungal infection in the mouth, what we call as oral thrush. It could be certain sexually transmitted diseases which are very severe. So these are the initial infections which a person whose immune system is waning may manifest. When the CD4 count becomes very low, 100, 50 or even lower, certain other conditions including tuberculosis, which can be very severe or disseminated. It could be certain other AIDS defining illnesses like cryptococcal meningitis, cytomegalovirus retinitis. It could be cervical cancer. So these are all conditions which, if a person has HIV and he develops during the late stages of HIV, act as AIDS defining illnesses. So these are all bacteria, viruses, fungi which can infect anybody whose immune system is damaged. So the presence of, say for example, cryptococcal meningitis doesn't confirm AIDS, but in a person who's HIV positive who develops cryptococcal meningitis, that's an AIDS defining illness. So I repeat, these are opportunistic infections which may affect anybody with a compromised immune system, people who have had transplants, people who are taking immunosuppressive medication, people on steroids for various reasons. In all these situations, the immune system is weakened. So they may get all these infections. So the presence of repeated diarrhea in a person doesn't mean that he has HIV. But a person who has HIV and has progressively worsening immune compromise can get recurrent attacks of diarrhea and weight loss. In other words, the symptoms of HIV is varied. It can affect any organ. It depends on the type of infection which the person comes or falls prey to. And unless we suspect HIV and do the test, it does not confirm HIV or AIDS.
Could you tell us about the diagnostic modalities?
HIV is diagnosed by a simple blood test which detects antibodies against the virus. This is called serology, and the mechanism of the test is what we call as an ELISA test. So an ELISA test for HIV detects antibodies against the virus which the body produces, and this is the definitive test for HIV or AIDS. There are other tests which we use to monitor and guide therapy. We can do what is called the CD4 cell count, which gives us an idea of the number of CD4 cells to see how robust the immune system is. We can also do a direct viral load test, which detects or estimates the number of viruses in the body. This usually runs from a few tens or hundreds to several million copies or international units per ml of blood. So these are the common tests, but the diagnostic test for HIV is still the serology or the HIV ELISA test. There is another test which detects the antibodies, which is called the Western blot test. The Western blot was considered definitive test in the early part of the HIV epidemic, but nowadays we feel that the ELISA is robust enough to even confirm the conditions. We have a 4th generation ELISA, which is what we use right now as a simple blood test.
Thank you, doctor. Could you tell us about the needlestick injuries that happen and how could it be prevented?
One of the risk factors for all healthcare workers is what we refer to as needlestick injuries. When we are using a needle to draw blood from a patient, when you are using a needle to suture a patient during surgery, there are chances whereby the needle may inadvertently poke the healthcare worker. So if I take the blood and inadvertently I try to recap it using both hands, I may push the needle into my skin. Even if I'm wearing gloves, there is still a risk that this may enter my skin and the HIV virus, if there is any virus in the blood, can be transmitted to me. So the needle stick injuries can be categorized as, is it a hollow bore needle which is used to take blood? Is it a suture needle which is actually a blunt needle without any hole inside? What kind of procedure I am doing? Whether the person is having advanced HIV where he has a high number of viral particles in the blood. So there are several factors which determine the risk which I may be subjected to if I have a needle stick injury. There are very clear guidelines based on experience on how to prevent these needle stick injuries for healthcare workers. One simple example is, after using the needle with a syringe, never recap the needle using two hands. You put the cap on the table, use one hand so that you lift it up and then you cap the needle. This is one simple intervention which all healthcare workers are taught to prevent the risk of needle stick injuries. Various other modalities including how to, when you're doing a suture during surgery, how to keep yourself and your colleagues safe, because you may do the suture but if your colleague's hand is close by, it may poke him. So these are normal protocols which we advise to minimize the chance of needle stick injuries. In the event that inadvertently there is a needle stick injury from a patient who's HIV positive or who's suspected to be HIV positive, we also have what is called post-exposure prophylaxis, PEP, which are antiviral, anti-HIV medicines which are given to the person who is subjected to the needle stick injury at the earliest, so that this prevents the infection from entering in and causing AIDS or HIV. So post-exposure prophylaxis is advised both for needle stick injuries and for other risk situations. It could even be a sexual contact, maybe a rape, where there is a possibility of HIV being transmitted. The antiviral medicines should be started at the earliest and given for a period of at least 4 weeks to prevent the transmission of the virus.
How can sexual transmission be prevented?
The prevention of HIV is, as I told you, by blocking the three mechanisms of how it is transmitted. One is through blood and blood products, which means you have to screen all the blood and blood products which are going to be transfused so that you keep the patient safe. Two is through needle stick injuries which may happen in hospitals, which we have just discussed. It could also be because of sexual transmission. So, which means that right now the barrier methods of contraception, which means the condoms, are the best initiative or intervention to prevent transmission of HIV during sex. So, if there is a possibility of casual sex, if there is a possibility of sex with unknown persons where you don't know the status of the person, always use a condom. Without this, the risk is always there when you don't know about the status, especially if it is not a monogamous relationship. Apart from preventing the virus spread through barrier protection, we can also use post-exposure prophylaxis after sex, which could have been high risk. So after the sexual exposure, taking antiviral medicines at the earliest, we can prevent it. There is another intervention called pre-exposure prophylaxis, what is called as PrEP, P-R-E-P, where typically for men who have sex with men who may have multiple partners, they are on antiretroviral medicines or anti-HIV medicines, antiviral medicines even before the sexual contact, and using this can prevent the transmission of sex. The PrEP is also used in certain couples where one partner is positive, the other partner is negative, and to minimize the risk of transmission, or if they are trying for a baby, to ensure that one partner is still protected, we can resort to PrEP. Lastly, I told you breast milk is also a reason of transmission of HIV. So if a HIV positive mother gives birth to a baby, we have to use alternative feeding for the baby other than breast milk to prevent transmission of virus to the baby.
Could you tell us if there is a cure for HIV and what would the management plan be?
Unfortunately, a cure for HIV is not easy. So far, there have been only about 3 cases in the world where HIV has been cured in people who are HIV positive. And this too was very serendipitous. A couple of them had malignancy or cancers, lymphoma, which was treated using a bone marrow transplant. And after the bone marrow transplant was done, they somehow were miraculously cured because all the cells which were HIV infected were destroyed, and the transplanted cells from the new bone marrow actually were very, very safe. But this cannot be a common method of cure. So as far as practical information goes now, we have only a treatment for HIV where HIV has become a condition like diabetes or high blood pressure, for which you need to take medicines regularly for years and years. People live for 30 years, 40 years after they are diagnosed. And if you stop the medicine, they can still become, the viral count can come back because the virus is not eradicated, it is only controlled. So the interventions have varied. Instead of daily tablets 3 times a day, it is now once a day. There are injections which you can take in once a month, once in 3 months, which probably give a better control. But we still don't have a cure which is commercially viable for patients.
Hope that comes in future. Could you tell us about the latest advancements in the management of HIV?
The management of HIV has become reasonably standardized. We have a single pill which you need to take once a day. The side effects are very minimal. So you pop the pill daily at the same time, and this will keep your HIV virus under control, just like your sugar or your blood pressure is controlled with tablets. The protocols, there are several choices for different people depending on their comorbidities, depending on the side effects they may experience, depending on, as I said, whether a woman wants to become pregnant. So there are several factors to take into consideration, but the regimens are very, very simplified. By taking this tablet, you can have a normal, good quality life for decades.
Could you touch on the average cost for the management of HIV?
The medicines are now very easily available. You get it free from government antiretroviral treatment centers, the ART centers. On an average, the drugs will probably cost anywhere between 1,500 rupees to about 3,000 rupees per month. A lot of them are subsidized, and this, if you cannot afford on your own, you can enroll in a government program and the medicine is given free.
Thank you, doctor. What are the common HIV-associated infections, doctor?
HIV, the manifestations of HIV depends entirely on the immune situation, the immune status, and the opportunistic infections which a person may suffer from. So it is very, very non-specific. A person with HIV, depending on the stage of immune suppression, may be perfectly normal, may have repeated bouts of diarrhea, may just have weight loss, may have skin issues where he get repeated boils, can get multiple attacks of shingles or herpes zoster. These are all very non-specific situations which anybody can get, even sometimes people with normal immune system. So you cannot pinpoint that it is because of HIV. But there are certain conditions which happen during advanced immune suppression, a decade after they have become HIV positive, not on treatment. As I told you, the cytomegalovirus, which is a virus leading to retinitis or involvement of the eye, certain types of fungal infections, certain types of tuberculosis infections, what we refer to as non-tuberculous mycobacteria. So these are more specific, and depending on the infection, the symptoms or the presentations also vary.
What kind of care do HIV-infected people need?
Unfortunately, HIV or AIDS still has a significant social stigma. I come across people every day who feel very frustrated because they come and tell me, "Doctor, I come to see you regularly, I am doing very well, but I cannot discuss about this to anybody, not even my family members. If I have a cancer, I can talk about it. If I have a debilitating condition like Parkinson's disease or dementia or something like that, I can discuss about it." But this is a situation where I feel so frustrated because other than my wife, nobody else knows about this and I cannot tell about this to anybody. So the social stigma associated with HIV, even though has improved with time, still is a huge concern. So people with HIV need psychological support, they need moral support, they need the fact that people care for them and people are able to look after them. So this is what I think is what people are lacking. People, I think the society has to accept them as individuals because a lot of them have got the disease for no fault of theirs. I have several elderly women who have developed, HIV in the late 90s following surgeries for which they were given blood which was not checked properly. I have had several children who have been transfused, unfortunately, in places where the testing was not properly carried out. So this is a condition which sometimes it is not, you cannot say if you are HIV positive, you are bad, you have done something wrong. It is nothing like that. It is unfortunately a condition which anybody can have. I recently came across a lady who is 8 weeks pregnant and as part of a routine HIV test was found positive. There is no risk factor, the husband is HIV negative and she has no clue how she could have got the infection from. The family is shattered. So they need support, they need advice from people who can help them lead their lives better, whether it is advice from a physician, whether it is advice from a psychologist or a psychiatrist. They need a family to help them rally around them. So I think community plays a very important part in the management of people who are HIV positive, and the current theme which we have,
Which let communities lead.
I think that's very apt for how patients who are HIV positive need to be managed.
As the ideal social message on World AIDS Day, the 1st of December, I thank Dr. Ram for spending the time with us. Thank you so much, Doctor.
My pleasure. Thank you.